So people who are diabetic, are they more prone to shoulder pain, shoulder arthritis conditions?
Actually, it's a very good question because diabetes, it's a very, very common condition. It's exploding in our country. If you think about it, in another 10 years, we will be the diabetes capital of the world. So the diabetes affects the shoulders as well. People who have diabetes are more prone to a condition called what is called as frozen shoulder or adhesive capsulitis. To understand this condition, we need to know that the shoulder is a ball and socket joint, and around the ball and socket joint you have a covering. If you imagine, it's like a ball that is put inside a purse. So the covering of the shoulder becomes tight in this condition of frozen shoulder. So it's like the purse is actually becoming tighter and tighter, and so the shoulder is not able to move, and there is restriction of movements. So these patients will have limited movements. They can't actually reach to comb their hair, they can't eat properly, they can't button, or they can't put their hand behind the back, and they also will have a lot of pain associated with it. And this condition affects the diabetics more because of their abnormalities in their glucose metabolism, and it also affects the other shoulder in diabetic patients. So it's very important to prevent this problem in diabetic patients, so they need to continue with exercises even if they're with the slightest hint of pain, and also to prevent this, even without pain they need to continue, or they should do shoulder exercises. But if they get this problem, help is at hand. We need to get some physiotherapy initially to improve the range of movement, but if the physiotherapy fails, there are advanced keyhole surgical measures which can actually relieve the pain and also improve movements at the earliest.